importance of beautiful smile, it is very important to have a good dental health. With this note, we start today's session. Today we have Dr. Sanket Reddy, having a clinical experience of nearly 16 years in prosthodontics and implantology. He is an executive council member for Indian Prosthetic Society and Asian Academy of Prosthodontists. He is currently a senior consultant of implantologists in Apollo White Dental. And welcome, doctor.
Thank you, ma'am. Good morning, everybody, and namaste. So today we're going to discuss about the perspectives in dental implants and the perceptions toward the dental implants from a general public point of view. We have come across dental implants from ages, and now dental implants are the trend, and that is the most promising prosthetic solution, that is to rehabilitate with people with no teeth. So there are a lot of myths, facts, and there's a lot of the clarity is a little less on that. So today we have this questionnaire session to clarify most of your doubts, which normally people come across, and we can clarify it. Yes.
Yes, sir. We have some set of questions which nearly 70% of patients which we come across during dental consultation for dental implants. Shall we start with the question, sir?
Yeah,
what exactly the dental implant treatment is?
Right. So this is a very basic question. Normally everybody asks, what exactly is this dental treatment is, right? The dental implant treatment is. So this treatment is nothing but to replace a missing tooth or a missing number of teeth with a foundation. Dental implant is nothing but a cylindrical screw which sits inside the jawbone and fuses with the jawbone and acts as a foundation for the future crown or bridge or denture, whatever it is. So this is the basis of a dental implant treatment, which has different varieties and different timings we can approach to it. So basically dental implant treatment is to replace the missing teeth with a fixed solution.
Next question, sir. How successful are these dental implants?
Success. So success is a multifactorial question. Success depends upon the age, whether the lesser the age, the higher the success rates are. Older, as the patients are growing more older, their regenerative capacity or a healing capacity, we call it as, is a little bit lower. And as we grow old, we also acquire some chronic diseases. So that also will hinder the success rate. On an average, if you see, with a lot of systematic studies going on, there is almost 94.3% success rate is being recorded as of date, which compared to earlier, it is a lot more increased nowadays.
And what are the advantages of dental implants?
Correct. So advantages is the how we look into it. So how everybody requires a dental implant. To put it together, these advantages I can divide into three major parts. One is a psychological advantage and functional advantage, and of course the biological advantage. So most important is the functional advantage. A lot of patients come to us asking for, I'm not able to eat properly, I'm not able to chew properly, I'm not able to talk properly. So for everybody, this is the only solution, because the dental implant holds either the denture or a fixed bridge or a single tooth in position retentively, that is tightly. So once the denture inside is tight, of course, I can bite on either side. Now, how do we bite? We have to bite. Normally, a regular bite is from chewing from left to right or right to left. When you have no non-supported dentures, when you're going to bite on one side, the other side denture lifts up. So automatically, the pleasure of eating, pleasure of the amount of the hardness of food you tend to eat decreases. So you will tend to go with a softer diet. You can't properly chew and then swallow. So with this, a lot of problems come: malnutrition, indigestion problem, and ulcer problem. So all these things are right. So when coming on to the function, eating is the first objective is which we can achieve with dental implants. Second most, we human beings are social animals, we all know, right? So we have to converse with a lot of people. For this conversation, most important are teeth. So if teeth are not there, you can't exactly, phonetics is completely lost. So in this situation, these implants will help you to keep the teeth in place, tight, so for you to deliver a proper speech. And that too, if you're a person where in the marketing side or in an admin side where you need to do a lot of talking, for example, teachers. So they all require this proper set of teeth. Of course, we all know if the teeth, we all look good. So therefore, I keep all these things as a functional requirements to look good, to eat properly, to chew properly, to swallow properly. And so these are the functions. The moment you achieve your functions, there your psychological the confidence is more elevated. The moment I can chew properly, I can be safe that my dentures will not fall down if I go to a function or something like that. So I'm more confident to go out. I'm more confident to reach people. So that is what your psychological being also gets elevated. So that is one of the most important. So once your function is elevated, your psychology is elevated, so that gives you, best confidence. So behind these two, there's one more important factor is the biology. One of the most important advantages what we see is that when you miss a single tooth, what do we normally do if we want to replace that single tooth? We normally we do a bridge for a fixed replacement by cutting the adjacent two teeth. That means the moment I cut, I am destroying two good sound teeth for replacing one more teeth. So that means it's a irreversible damage I am causing onto the tooth to provide something else. So if I want to put an implant, I don't touch the other teeth. It is just one implant and a crown on top of it. Everything is perfect. So that means I am going to save the biology also. If you're going to lose some tooth, what exactly happens is in that, if you've seen, there is a small depression in the bone also. That means the jaw bones are such a type that if one tooth is removed, the jawbone thinks that that area of bone is not necessary. So it tends to resolve. It tends to go away. So once you install an implant inside, that proprioception keeps the bone alive and it does not allow to resolve. So these are many factors, where the lot of advantages these implants have.
Can anyone get implants done, sir? Dental implants done?
Yes. So right now the science is so going ahead. It is for everybody, but in science there's always buts. So people where we are a little skeptical to do implants are like heavy smokers, people who are like chronic diseases like diabetes, hypertension. So for these set of categories, we will try to have some sort of precautions taken, and still we can deliver them. But people with a little bit deeper ailments like radiation, who have undergone post-cancer irradiation, people who have osteopenia. So these kind of people we would try to avoid them from implants. So only a very few set of people where we can't deliver these implants. The rest, I think, with minimal precautions, we can give implants.
Or dental implants are safe?
Of course, they are very safe. Coming on to the research and development which has happened all these days, the dental implants are the safest procedure, because whenever a person who's undergone a simple extraction, they can easily get an implant done. So that is the utmost safety of implants done. And also these implants are biocompatible. That means any implant which is placed into the body, it's a metal cylinder which goes into the jawbone. So that means any metal which goes into the jawbone should be biocompatible. What is this biocompatible? Is that this material should not corrode. If a material is not corroding, it is a biocompatible material. And titanium has even more higher properties of being very strong and also no corrosion, and it has a very stable oxide layer on top of it when compared to any other metal. So therefore, this dental titanium implants are the safest procedures available now.
How painful are these dental implants?
So I think this is one of the common questions everybody asks, right? So how painful? Pain is an individual's perception. When we operate here, almost all the people, when given a scale of 1 to 5, 5 being most painful and 0 being 1 being negligible, we always have a feedback of 2 or 3 in a pain scale. So So on top of this, we give you, an individual-based prescription of antibiotics and the analgesics, so which will keep your pain to a minimal extent. And I don't say it's a painless treatment. It has a pain because there's a surgery involved in it, but it will be kept very minimal with all the procedures, sedation procedures available right now. We can do it with minimal pain.
Let's come to the affordability part, sir. Is insurance cover is available for the dental implants?
In the states and in the Western countries, dental implants are included in dental insurance. But unfortunately, in India, that is not the scenario, and we are also hoping that will happen in the near future. So, as far as now, according to my knowledge, there are very few insurance companies which are covering dental procedures and implants. But not to the extent that which has to be covered. Yes, there is availability, but there are a lot of various schemes also available. They are there.
Post implantation, will there be any interference with MRI or CT scans procedures?
Very nice question. So very few people ask about this. That is the question is that once we place an implant, and the implant stays in for life, correct? So when in later life, if the patient has to go for an MRI or a CT scan, will that, mostly MRI, CT scan will not interfere because CT scan does not have any magnetic waves. CT scan is just a radiating waves, that's all. So in a radiating waves, there can be like a slight scatter. If you just inform to your doctor, radiologist or a technician, they will adjust accordingly. But when coming on to the MRI part, MRI is a magnetic resonance imaging, right? So these titanium implants are non-ferromagnetic materials. So that means they don't interfere with magnetic resonance. But still you have to precautionally inform your radiologist and the technician before going into the MRI. So they will adjust the radiation, so you can have it done safely.
What are these dental implants made up of?
Correct. So these dental implants, normally they are available from Aegis, but these picked up popularity once when it was invented in titanium. So mostly, almost 99.9% of dental implants today are either titanium or titanium-based alloys. So this titanium is a stable oxide-producing material, which is a biocompatible material. Almost it is the same material which is being used for any other implantation therapy in the body. So they are safe also. And recently there are a few manufacturers are coming with zirconia as an implant material, but still there is a lot of studies has to go into it, because these titanium dental implants are there for more than almost 75 years. That is, we have retrospectively, we have 75 years of study on this. But zirconia implants are recently, only around some 20 years they are being developing, but we need to wait and watch how they're going to react. Once, I hope, if they're going to do good, and that is going to be the next trend of dental implants, zirconia as dental implants. So basically, it's only titanium or some of zirconia available right now.
This question is, what is the difference between the implants which is placed immediately after the removal of the teeth and time to placement?
Okay, so when implants started long time ago, it was to place the implant and leave them for 6 months inside the jawbone. So therefore, the biology, that is, the bone cells will grow onto the implant, and once they fuse it, it becomes rock solid. But with the eventual, the progress of the research and development, so we have come to a state that we can, within 6 weeks, we can place a crown on top of the implant after placement. So this 6 weeks waiting period, we call it as a traditional placement. We place the implant, close it, and wait for 6 weeks, and then another date of after 6 weeks, we can place a crown on top of it. So this is a traditional thing. So right now, there are a few implants which can take up immediate also. That is, I can remove the tooth, I can place the implant on the same day, and we can even give a crown also on the same day. So that is the research today. So these are called as immediate implants. So we can remove the tooth and place the implant immediately, are called as immediate implants. So this is what right now trending everybody is doing here. So we can't wait. Nowadays, I can't be without teeth for more than 2 or 3 days. Some cannot even be for the same day also. So in that situations, we can remove the teeth and place the implants immediately, and next day morning you can walk out with new beautiful set of teeth, fixed teeth.
So, what to do if an implant fails?
That is an eventual question there. Yes, nobody can say that implants will not fail. Implants are like any other treatments which we are rendering. Yes, they might fail. Failure in implant is, it happens only one way. The implants become loose. So there are no other big complications that there's a lot of infection, there's some kind of a necrosis happening. We don't see that. It's completely negligible. So most commonly implant failure is that implant rotates and implant just pops out from the body, from the jaw. In that situation, we will wait and then go for a re-implant treatment after 6 months or so. Once the bone has reformed, so we can again place an implant and then we can check. But if it is going to still reject, then we need to check whether there are any other systemic conditions or not and then proceed. Normally, we take all these precautions before itself, and we don't try to attempt those kind of implants in that type of patients. So that's why our implant failure rates are kept to very minimum. Yeah.
So apart from these questions, we have some specific questions given by the patients. He's wearing his upper and lower full denture set for an year and is very uncomfortable to wear, not able to eat with the dentures on. And the lower especially is loose. Am I looking for the fixed teeth?
Correct. As I told you, the benefits of implants, that is what the answer for this is. I assume that this gentleman is missing all the teeth and he is having upper and lower full dentures. Right. Full dentures, it also depends upon how long he is wearing these dentures also. If you're going to wear for a very long time, what happens? The bone also tends to resolve very faster. So in this case, I would look at implants as one of the alternate or the best solution available for them. We can even do a simple 2 implants in the lower jaw, and we can just fix it with, it's like a removable denture with more foundation. So that it's called as an implant retained denture. It's a ball denture, we call it as. So that kind of a denture we can fabricate, and it has been completely documented. There's a lot of research happening in this area of lower 2 implants and upper is a normal denture, which will elevate the patient's biting efficiency, chewing efficiency, the level of confidence. It is more stronger inside the mouth. So this is one of the basic treatments. If you see in the European countries, this is a standard of treatment which is provided by the government itself. Moving a little bit more, next what he has asked is the fixed type. Yes, of course, certainly we can do a fixed type. We can do a full fixed type. You will not have the plate also inside. We just have to place 4 implants in the upper, 4 implants in the lower jaw, and we can give a beautiful fixed teeth which you cannot remove, but only we can remove on a service maintenance phase.
Yes. Meanwhile, we got some question from the viewers, from Mr. Chaitu Reddy. How successful are the dental implants? Is dental implants is safe during COVID-19 time? How painful are these dental implants?
First class. So there are 3 questions in this. The first and the last question which we have been addressing, and the mid question is very relevant to these times is how safe is a dental implant safe during the COVID-19 times? During COVID-19 times, the dental implants are elective procedures, but that doesn't mean that they are not an emergency. For example, this COVID-19, people thought it will be there for a month or so, but it's almost more than 100 days past. And if I'm not having a tooth, for example, a molar is missing, and I'm not going to replace a molar for almost like 3 to 4 months, yes, of course, there is going to be a tooth mobility, and the entire dentation arrangement is going to be changed depending upon person to person. Of course, this is also an important, it's not an emergency treatment, it's an important treatment. So in this COVID-19 times, you need to take care that, so are the clinics which you want to visit are COVID-19 ready? That is, do they have the basic infrastructure of, the protocol of the clinic which is being displayed for you, and how do they maintain distance, how do they maintain cleanliness in the hospital, and how do they maintain patient after patient. So if you know your clinic properly, I think it is not a difficult procedure in these difficult times. You can still get it done during these times.
And then another specific question, sir. I got my right molar tooth extracted, but now I'm contemplating between the bridge treatment and a dental implant. Which one is a better option?
Correct. This also is one of the advantages of an implant. See, I think you all can visualize. See, if there are three teeth, 1, 2, and 3. 3 are there. In between, one is missing. So what is there's a gap between these 2 teeth. So what happens now? The basic treatment we call it as a bridge. That is, I am bridging the gap between these 2 teeth with the help of these 2 abutments. We call it as the posts. So what normally we do is we try to grind the teeth. Your dentist will grind this tooth, and make it like pillars. Once these pillars are made, we take a record and we give a bridge. That is, 3 teeth together is called as a bridge, 3 or more. So this is a bridge kind of a treatment. So for this bridge treatment, there are various advantages, disadvantages. Advantages, yes, it's immediate and it's more economical. But I am going to destroy these 2 teeth irreversibly. I don't call this a destroy, it's an irreversible damage. Once I cut the tooth will not grow back if I don't want the bridge treatment, right? So it's an irreversible damage to both the teeth. Sometimes, most number of times, both these teeth might require a root canal treatments also, because I need to prepare a little bit more depending upon, for our Indian scenario, we have smaller teeth. I need to prepare more for that bulk of the material. So end up in root canal. So we need to do root canals. I'm going to do a irreversible damage. So on top of this, the empty space where there is only bone, there is no tooth, that keeps resorbing, that keeps becoming thinning and thin. You lose bone on day. For example, after like 5 years of doing a bridge, there will be a big depression. So at that point of time, if I want to switch back to an implant, it is a little difficult for us to switch back because the bone is already gone. We need to do some accessory procedures for me to give an implant. So the best option right now is, if the other 2 teeth has no decay, everything is sound, then it's going for implant is a highly advantageous situation.
So the next question is, what is all-on-4 implants?
Okay, that is the trending in Google, right? Once you go into Google and then you type into a fixed denture or a full denture, the first thing which is going to pop out is all-on-4. So this is a treatment found by a doctor in Portugal. So he has it is designed as if that for replacing one full jaw, that is like at least minimum of 12 number of teeth in one jaw, you don't have to install 12 implants. You just have to install 4 implants in a strategic position. That is what all-on-4 means. We place long implants, tilted implants. There are different components for it which will go into it, and these components are all milled to precision. They are not handmade. They are all machine made in a milling machine. So that is the all-on-4 treatment, where we don't have to wait even for the implants to heal. We can directly load, because there are 4 implants. I'm going to balance all the implants and then give a big bridge. So with this treatment advantages, that even for lesser amount of bone available for a certain person, we can install these implants and give a fixed bridge for everybody. So that is the all-on-4 treatment.
Okay, sir. Thank you, sir. And next we have another question from the viewer, sir. Are dental implants are removed like dentures, or do they stay in our mouth?
See, dental implants as such are fixed. These implants, as I told you in the first, these implants are only foundation for a denture. Okay. For example, if I have to build a denture, if I have to build a roof, I need to put these 4 pillars, right? It's just like that. I'm going to place these pillars inside the bone and allow it to heal. Once these are healed, you cannot remove until unless they are going to fail and come out, or I am going to cut the entire bone and then remove, or else they are not going to come out. So these will act as a pillar to take the load. On top of these cylinders, there is some mechanism where we can place the implant, the dentures. So there are different varieties like placing them. I can do a removable variety, I can do a fixed variety. So there are both the varieties available, whether I can fix it or I can remove it depending upon the patient's requirements or the amount of bone or the financial aspect. So keeping all these in mind, we will devise whether we want a fixed or a removable. So as such, implants are fixed inside the bone. Only the denture can be fixed to the implants, or they can be removable where you can remove it every day and then put it back. So both are available.
Again, we have the same questions. The post implants, will there be any interference with the MRI and or CT?
Yes. So as I told you earlier, CT scan, see, there is going to be an interference. I don't say that there is no interference, but they're very negligible. And if you always intimate your technician or your radiologist, and they know how to take care of it, and they can get it done for you. And for MRI especially, as I told you, these titanium implants are non-ferromagnetic metals, so they don't cause such a kind of interference.
Okay, sir. And the same question, I guess, what are these dental implants made up of ultra?
These dental implants are made up of titanium. They call it as a CPT. It's a commercially pure titanium or a titanium alloy. So only these can be made as a dental implant and then placed inside the bone. So according to the FDA, US FDA's approvals. So there are few other implant companies which are coming up with ceramic, that is the zirconia as a dental implant material. But zirconia has a lot of advantages and disadvantages. So people are still working on it. A lot of R&D is going into it. Hopefully in the near future, they are going to come as our dental implant materials also.
And another specific problem question, sir. The patient has asked, I'm very apprehensive about the implant surgery, but I wanted to get it done.
Yes, everybody is apprehensive about a surgery because it involves a knife, it involves blood, it involves pain. So these three things, this is a triad which goes into an apprehension. But this is not any more complicated than a tooth removal. If you have undergone a tooth removal, and I don't think it is any more painful than a tooth removal. It is even, I think even it is lesser than that. So therefore, pain part is very, very minimal. So apprehension is mainly because of pain, right? So there are a lot of methods to control apprehension. So we have a sedation procedure where we can partially put you into sleep, so you don't remember the pain here, what is going. So we have a dedicated anesthetist who will be monitoring you throughout the implant surgery session. So therefore it is very safe, and it also keeps very simple procedure for you to undergo. So I don't think there's anything to apprehension if you're going to undergo these kind of procedures.
Yeah, we have one more question from our Facebook viewers, sir. What are the disadvantages or the side effects of dental implants?
Okay, so disadvantages is, of course, it's pain. It's a surgery. That is the only disadvantage where I can think of. Side effects, I don't see any side effects from these implants as such, because it is not a medication where it is going to secrete some kind of a medicine into the body, or it is not going to react to your body. So side effects are very negligible. But yes, what are the disadvantages? Yes, is that it has a component of surgery in it. That is the only disadvantage. But there's one more disadvantage, is that not every time you can place an implant and then give a crown immediately. Sometimes you have to defer it. You have to do on a different date of implant placement, and then place an crown on a different date. So this might be one disadvantage where you cannot give a crown immediately. So for people who are looking at a crown immediately, and if the biology is not accepting to it, then it's a disadvantage for them. But for others, we can do it. So I don't call it as an absolute disadvantage. It is perspective-wise.
Thank you, doctor, for sharing such a valuable information on perception towards the dental implants. Viewers, if you have any doubts, please do visit our dental centers or contact us through our website for the appointments. Thank you.
Thank you.